What are the side effects of metformin? Is there a difference between the extended release and the fast-acting hydrochloride version? Based on dose, which one is easier on the body? Are the brand names still available, and how do they compare to the generics? And finally, how would one take metformin if intolerant? But before we begin, let me welcome all of you resilient diabetics out there and a whole host of new non-diabetic viewers looking to improve your lives. This is the channel we turn ordinary, struggling diabetics into extraordinary, well-controlled diabetics. If you don't know who I am and you are brand new to this channel, I welcome you. My name is Jay Sampat, and I became an insulin-dependent diabetic a little over 6 years ago due to an autoimmune attack which caused the destruction of my pancreas as a result of a severe gluten allergy response. So basically, I am the proud owner of a pancreas that's gone on a permanent and lifelong vacation. So not only am I diabetic, just like you, where we will be walking that walk and talking that talk together, but I do also have a University of Bachelor of Science degree in nutrition dietetics, and that does come in very handy in discussing all of these intricacies of being a diabetic. Now, don't forget to hit that subscribe button, followed by the gray notification bell, then choose turn on all notifications if you want to be notified when a Resilient Diabetic video has been published. As with all of my videos, this should not be considered personal medical advice. This is my interpretation of the latest research. If you want medical advice, please always consult your physician. When I was first diagnosed with diabetes, I was given metformin as my standalone medication, and the doctor put me on that immediately. However, I was initially severely misdiagnosed as a type 2 instead of a type 1, or if you'd like, a type 1.5 LADA, which is an insulin-dependent diabetic because of the autoimmune attack on my pancreas, which I was never tested for. So, metformin did initially slightly lower my blood sugars, mainly because I was still exercising, and I'll point out the importance of that later. But it could not drop my blood sugars anywhere near the non-diabetic range without insulin. So yes, metformin is generally given as the first-line treatment, either used alone or in combination with other agents for newly diagnosed type 2 diabetics. But now it is also used as an off-label treatment for type 1 diabetes, prediabetes, gestational diabetes, PCOS, which is polycystic ovary syndrome, weight loss, and now it is in many trials across the world for its potential in anti-aging. Could it be the fountain of youth? The other new areas of research suggest that metformin may preserve cognitive function and reduce mortality, along with data that may also support the cancer prevention potential of metformin. And I want you to take notice and take note of all of these off-label uses are related to one thing: the control and the reduction of both blood sugars and circulating insulin levels. That is the key to your health. Second, and just importantly, one also has to remember these off-label uses for metformin have not been approved by the FDA. On a side note, which I've known for years, it is being used heavily by not only athletes, specifically in the anaerobic bodybuilding and strength circles, but by many athletes that require a lot of carbohydrates to be consumed around the clock. And why would they also be using metformin through their doctors? To increase insulin sensitivity. So the athlete benefits from both greater muscle mass and fat loss too. However, many professional athletes may look like they are the models of health. They are lean, muscular, have that all-important six-pack, but many are suffering from the same debilitating health consequences society is as a whole. Heart disease, diabetes. Yes, quietly, many professional athletes are type 2 diabetics. They have blood pressure issues, calcification of the arteries are also prominent. Just because one is exercising and training to the extreme does not mean they are immune to Syndrome X, especially if one is being fed an excessive amounts of carbohydrates year-round with no breaks. And how is this related to you in particular? 1 in 3 here in the United States are now pre-diabetic, and it will only get progressively worse. With many of those 1 in 3, guess what? They're exercising, but they are still eating the standard but ill-advised diet heavy in carbohydrates. This has caused the body to become highly resistant to insulin over time, even with exercise present. The excessive carbohydrates, once eaten, are then converted to fats known as triglycerides by the liver, which then gets stored in all the wrong places, such as inside the muscle tissues, within our livers, and in and around all the body organs. As we've discussed in numerous episodes, these fats or triglycerides are not coming from the fats we eat, but rather the excessive carbohydrates that have been consumed, both the good and the bad. Our beloved, bought off and paid off healthcare institutions and healthcare experts have pushed saturated fats and cholesterols as the evil of health, when in fact it's been carbohydrates this whole time. This is why someone can be lean without any subcutaneous fats yet suffer from diabetes. It's the fats stored inside the body that cannot be seen that is causing the damage. I'll create a link in the description box below to the episode Diabetic Snacks. This is where you'll be exposed to some scathing realities. Who are the mysterious proponents pushing the established nutritional agendas, and why? And how do these corrupt, manipulated agendas like snacking influence your treatment and lifelong expectancy? So the big question is, how does metformin fit into all this in terms of both prescription and off-label use? Metformin helps insulin work better by helping muscles use glucose in a more efficient manner. In other words, it increases the sensitivity of muscle cells to glucose so that the excessive glucose in the blood can be removed and stored inside the muscle as glycogen, instead of either being converted to fat and then stored, or to continue to be floating around in larger and larger amounts, destroying nerves and small blood vessels alike. So this is a twofold mechanism. When insulin works better and insulin sensitivity improves, the amounts of insulin needed drops. Thus, one's pancreas does not have to work so hard, or in my case, less insulin is needed to be injected. What is the take-home message? The lower the circulating insulin levels, the less the bodily inflammation that arises, the longer one can live without complications. If you remember, I have been using metformin since the day I was diagnosed around 6 years ago, but my new endocrinologist asked me to see if I was interested in discontinuing it as a trial to see what would happen. Well, what did happen? During those 4 to 5 months, my insulin requirements did go up and my body composition did change. So I asked to be put back on it. But this time, I wanted to try out the name brand extended release tablets instead of the generic hydrochloride versions I was getting. Here's a picture taken last Tuesday where I was weighing in around 177 pounds. And now, because metformin is back, I am using around 3 to 4 IU less insulin per day while eating the exact same diet. So prior to that break, I was still, however, getting some minor gastrointestinal issues from time to time over those 6 years, which leads us to what are the side effects of metformin and how can we avoid them. Metformin, like any medication, results in a spectrum of responses. This is why it should always be prescribed by your doctor. According to the research, a quarter of the patient population does extremely well. Half the population does rather well, and a quarter of the patient population doesn't do well at all. And one of the major factors that just come to light is related to which version one gets and who that manufacturer is. Most people who take metformin tolerate the drug pretty well. However, 30% of people experience these gastrointestinal side effects such as diarrhea and loose stools. The other side effects of metformin can include nausea and vomiting, a runny nose, low blood sugars, excessive sweating, chest discomfort, headaches, and even weakness. In rare cases, metformin can cause lactic acidosis. The risk of metformin causing lactic acidosis, however, is exceedingly rare. A Cochrane systematic review of 70,490 patients with type 2 diabetes on metformin did not report a single case of metformin-induced lactic acidosis. Labels for metformin, however, have now been recently changed to say patients with late-stage chronic kidney disease should not use the medication. And what about the liver? The liver isn't involved in the processing and metabolizing of metformin. Instead, metformin leaves the body unchanged in the urine. So liver injury due to metformin is also very rare. Patients who experience this reaction usually have used metformin for 4 to 8 weeks at the same time they've been using other medications that can cause damage to the liver. Metformin may also affect the absorption of vitamin B12. So doctors will generally monitor B12 in people who have been taking metformin for more than 4 months and then recheck B12 deficiencies every 2 to 3 years. One of the hurdles we face in using metformin is now due to quality control. The explosion of diabetes that's become a worldwide epidemic has now changed the landscape of available metformin. Glucophage XR, or the extended release brand name, has been discontinued by Bristol Myers. They stated it was a business-related decision to discontinue manufacturing of these products. Express Scripts even reported one of their last name brand extended release products experienced a price jump greater than 800% in 2015. So all we have left on the markets are the generic manufacturers. And if you've been following me and you are subscribed, and I know you are, you remember I have mentioned that over the past 5 to 6 years, I've been getting refills of metformin from several different manufacturers, all having different tablet sizes and even smells. Some bottles, once opened, even have a rotting fish smell to them. Some tablets from some manufacturers give me more distress than others. So my suggestion is to write down the manufacturers that you are getting and note the side effects. If refills change, note that too. That way, if you find one that works really well, ask your pharmacist to fill your prescription with that brand and manufacturer. Because this is a $1 billion market now, some manufacturers will cut corners and quality at your expense. In fact, some metformin supplies in Singapore had just been recalled after authorities found they contain a small amount of cancer-causing chemical called NDMA. So after months now of being on the extended release tablets, even though they too are generic, I can say it does have substantially less stomach discomfort than the hydrochloride version. The one side effect I do have since going back on are some of the hypoglycemic episodes or low blood sugars I have after weight training at night. I have to continually keep tweaking my basal insulin dose to get this corrected. Everyone will respond differently as to the degree of sensitivity metformin brings based on dose and the version they're using. As mentioned earlier, many patients do have intolerable GI side effects from metformin. So how do we go about resolving that? Well then, we have to look at what some of the gold standard doctors such as Dr. Bernstein are doing and advising in these cases. He states to have your doctor first prescribe the extended release only and start with the lowest possible dose of 500 milligrams a day. And the metformin should be taken at the end of the meal. If you get discomfort, try and stay on it for at least 3 weeks. By then, the discomfort would have likely dissipated for many. Then, and only then, would you gently and slowly add in another small dose until you get to the total daily dose that is required. Some doctors even recommend they break the tablets into half at 250 milligrams if problems persist. Once there are no further GI side effects for at least a week, they then have them increase it to a whole tablet. One caveat when it comes to metformin. Metformin is not the green light to eat excessive amounts of carbohydrates, especially if one is a pre-diabetic or a type 2 diabetic and think magic's going to happen. One cannot have their cake and eat it too. It works best along a lower carbohydrate food intake. And for me, that is a diet based on lean proteins and above ground, non-starchy, cruciferous vegetables. I will set up a playlist for you with more videos on metformin, including one specifically on weight loss. If you're on your desktop or laptop, I want you to use your mouse to click that box. If you're on your mobile device, I want you to tap that with your fingers. The first link is to subscribe to this all-important, life-changing channel. The second is the link to the playlist mentioned on metformin. So, have a great and productive day, and we will see you soon with another new episode, which are generally released weekly. Bye for now.